Hi everybody, it's Dr. Ansari. I'm going to be talking to you briefly about initial interstitial cystitis treatments when you're getting a flare-up or maybe it's the early phase. Remember that you should always do these under the supervision of a physician, and really first and foremost you should see a physician for diagnosis, and after which you can implement these types of treatments. Not every treatment is for everybody, so you may have medical conditions that may not allow you to take some of these things. While you're initiating some of these treatments under the supervision of a physician, your physician is probably running some tests like a urine culture to make sure there's no infection, or maybe even doing cystoscopy, which is looking into the bladder with a camera just to make sure there's nothing else going on. Once all of those come back negative, that's really when the diagnosis of IC can be given, because IC is known as a diagnosis of exclusion, meaning you have to exclude every other possibility first. So all of your tests have to be negative in order for you to receive the IC diagnosis. There is no test for interstitial cystitis or painful bladder syndrome. So one of the first things to consider is maybe starting an allergy medicine, anything over the counter that you take like Claritin, Allegra, or Zyrtec, because that helps to decrease the histamine that's in your body. And histamine is a known inflammatory agent within the body. It promotes inflammation. So it helps decrease that around your body, and your bladder is part of your body, so it's going to help the bladder out. Number two is one can consider taking acid reflux medication. And the idea here is that it helps reduce the acidity in the stomach, and that gets added to the food that you're eating. You could take like a Nexium or a Pepcid every day. Other people like taking just some Tums or something called Preleaf. It's all over the counter. You can take those Preleaf or Tums before or right after meals to help neutralize any acidity before it hits the bladder. Additionally, what's really important is identifying food triggers. So there are certain foods that people eat that might be causing the problem. Maybe you've suddenly increased your caffeine intake. Maybe you're drinking more alcohol. Maybe you started drinking more seltzer or soda. These are known substances that cause bladder irritation, and bladder irritation then increases the inflammation. So typically we do a food elimination and reintroduction method. So that means you abstain from your typical diet and take in more bland items for 2 weeks, and then after that you reintroduce one of the acidic foods or irritating type of foods per week. You, like for instance, let's say you cut out tomatoes, so then after the 2 weeks of bland diet, you start eating tomatoes every day on the 3rd week to see if that makes you feel worse. Then after that, you can try chocolate the week after, and the week after that, strawberries, or bringing back coffee or bringing back black tea or soda. That way you can identify which food triggers you have. This is a long process. It takes a lot of patience, and it's ongoing, because you may find that it wasn't anything you were taking every day, but something special you had like at a party. Like if you don't drink alcohol, maybe next time you have a glass of wine, all of a sudden you'll end up with a pain flare. Not all triggers are food related. Just remember that there are other things that can cause IC flares, like stress, or maybe it's infections like a urinary tract infection, or even a cold that just increases the inflammation in the body because you had an infection, and then the inflammation lingers. For helping with very painful flares, you can try taking something called Non-Steroidal Anti-Inflammatories. So this is basically ibuprofen or Motrin, Aleve. Again, you have to work with a physician because you might have a medical condition that may not allow you to take NSAIDs. But this is good pain relief for when you're having a flare-up. You can also take Pyridium, which makes your urine orange. This is over-the-counter called Azo for urinary pain relief. They have different types of Azos, so you want the one for urinary pain relief. You can also take something called Methenamine, and this makes your urine blue. This is often a prescription. Methenamine. It can be known as Urabel, Urogesic, I think Eurostat, maybe another one. So all of these help you get through a pain flare. It's like Tylenol. It doesn't stop the pain it doesn't cure the problem, but it just helps you get through it, because a lot of times the treatment is time. You need more time to get over the flare. And if you've given sufficient time and it's not getting better, then that's when you talk to your doctor again and say, hey, it's not getting better. I want to move on to a different therapy, which we're going to talk about in the next set of videos. So everything that we talked about today is to target the inflammation, so that we're trying to knock this one out, so that it prevents the pain and urgency, or tries to improve the pain and urgency aspect of it, okay? Thanks for watching.